So before we find out about what maintains post-traumatic stress disorder, and indeed what causes it, let's actually sort out what it is. PTSD is a mental health condition or diagnosis, like schizophrenia or depression or influenza for that matter. A doctor looks at the symptoms involved and then actually prescribes a diagnosis. And for mental health conditions, those diagnoses are usually set by major organisations like the American Psychiatric Association that publish what they consider to be diagnostic suffering in manuals such as the Diagnostic Statistics Manual. Now, there are huge benefits and disadvantages of using a medicalised system with psychological conditions. However, that's a commentary for another video. Thinking about PTSD as a diagnostic category gives us some clarity about what it is we're talking about over this course and over this video. So in order to have PTSD, you'll have had to have had an event or witness an event in which your life or the lives of those around you has been very seriously compromised. There's been a very real risk of death, serious injury or mutilation. Sexual assault is also part of this category and is a category where there are high rates of suffering such an event and then later receiving a diagnosis of post-traumatic stress disorder. And indeed, there is a correlation between what kind of trauma and the proportion of people who go on to suffer PTSD. Turning towards the symptoms themselves, it's these memories, these experiences that come back in reliving or re-experiencing symptoms, such as intrusive memories, flashbacks, or nightmares. What characterises all of those is the person experiencing a degree of bodily activation. Their body and their senses feel what was going on at the time of the event. So there might be pain, there might be the clenching associated with the anxiety of the event, the person might hear sounds associated with the event, or even see the phenomena that happened. Indeed, there might be smells or tastes which were there at the time of the traumatic event. Depending on the degree to which somebody experiences these during their conscious waking life is either categorised as an intrusive memory or a flashback. In a flashback, the person immersively experiences the event again. It literally feels like it's happening all over. And there's a shift, there's a disruption in the person's conception of time and space, as they increasingly sense that the event is unfolding around them. An intrusive memory doesn't have that disruption in time and space. The person retains a sense that they're still in the here and now, but that memory has involuntarily come back with that degree of bodily activation as if they feel like they are back there. Similar to a flashback, in a nightmare, the person will remember or experience the event or something very similar to the event happening over, and in unconsciousness they will experience the same kind of reactions as they did at the time. These are very, very often forceful enough to wake the person from their slumber. And in that state, having just woken, the person will frequently be disorientated enough to have a sense that they are back there again, suffering the same emotions and the same bodily reactions. And very frequently, this will endure for the PTSD sufferer throughout the day. Now, as it sounds, these are really awful experiences to have, and very frequently in post-traumatic stress disorder, they become triggered relatively easily at things people both remember about being about the event and other things in less processed memories where there doesn't seem to be a definite trigger that brings about the symptom. Very understandably, avoidance then becomes part and parcel of the way someone copes with these things. So there will be a degree of either trying to avoid thinking about the memory or thinking about thoughts related to the memory, or avoid people, places and circumstance that remind about the memory. Very frequently, this will involve the place where the event, the trauma, happened, and can involve things like people who look similar to the attacker in those circumstances, avoiding things that remind us of the place or the person or the event. And these can sometimes be very subtle indeed. They can be things such as colours or shapes or any nuance that is just enough to bring back this really toxic memory. Avoidance also comes through avoiding the emotions involved in trauma and indeed the memory and our reactions to it. So some people might use alcohol or illicit substances or even self-harm to suppress and dissociate from the horrible feelings that have arisen due to this event and indeed due to our responses and our reactions to the event as it comes up in memories and these kinds of symptoms as I've explained. And so it's also very understandable that if we're suffering from these really, really unpleasant flashbacks and intrusive memories when we're prompted by things, we might actually start to become very on guard and watchful about being triggered, or watchful as to our greater sense of safety in the world, our own sense of integrity. And that's why hypervigilance is part of a PTSD diagnosis as well. Hypervigilance means exactly that, feeling anxious or on edge or irritable a lot of the time as the person concentrates and focuses their efforts on protecting themselves, maintaining their sense of integrity. Given that we're on guard, our startle response might become very marked. We might become very, very responsive. It will also become more difficult to experience positive emotions and potentially engage with interests and hobbies, as indeed no one plays when they feel threatened. No animal goes and frolics and runs around and jumps around if in fact they feel that a predator is nearby. And so we can see through these symptoms that a person's responses or reactions very much change after trauma by way of these re-experiencing symptoms, intrusive memories, flashbacks, nightmares, a sense of hypervigilance, and a sense of wanting to protect, which often goes in the way of avoidance of sorts. There is a form of avoidance which is very different from the withdrawal that I might characterise in things that I've talked about. For those who are combat trained or for those who are very, very physically confident, very frequently avoidance looks like engagement as they become more aggressive and potentially become involved more in fights. And this is, again, in the bodily response to try and protect themselves. But why I think about this as avoidance is actually they're avoiding the capacity to feel safe again now that that trauma has arrived. They're avoiding a non-aggressive interaction with the world, which presumably would have been the case prior to the traumas that had caused them anger, irritability and aggression. The last category of trauma is not about responses or reactions though, it's about beliefs, or the meaning that we give to ourselves, other people, the trauma, the world. As part of PTSD, there's a very definite change in the meaning that we attribute to these things. So whereas previously I might have thought about myself as a good person, I might afterwards, in my suffering, consider myself to be weak or vulnerable. I might have considered that the world was a safe place, but after the trauma, I think it's erratic, it's unpredictable, it's dangerous. Depending on what's happened, it might change my view of other people. I might have previously thought that generally people were good, people were nice. But if I'd actually been a victim of something, that might change my conception. I might think that people are just out to get each other. I might think that they're just aggressive. Similarly, people develop beliefs about the trauma itself. I shouldn't have been there, I was unlucky, or conversely, something like I deserve it. And also, as people suffer from post-traumatic stress disorder and have all of these awful symptoms that we've witnessed, then indeed their belief about the future might change. They might actually think that things look pretty bleak, that they don't have a future, that life will just be full of the suffering that they're witnessing at that time. Blame is also very much part of what changes during trauma, as people develop conceptions about whose fault it was, whether it was their own, or whether it becomes very, very firmly placed in other people. And indeed, where it becomes firmly placed in other people, perpetrators, people who've been negligent, for example, very often there's a lot of anger associated with that kind of appraisal, that kind of thought. And so there are the categories, there are the sets of symptoms that characterise post-traumatic stress disorder. It's also important to note that very frequently those symptoms are there in the immediacy of something bad or threatening happen for us all. So most people demonstrate PTSD type symptoms in 6 weeks or maybe 3 months after a trauma. And indeed, depending on the diagnostic manual you're looking at, there's a difference in the time that one must continue to suffer with these symptoms before a diagnosis of PTSD is given. In order to receive a diagnosis, there must be sufficient disruption to one's life and functioning. And also an additional category is in dissociation. So the symptoms might be present, but dissociation is also present. And dissociation is where our perception becomes unreal, or it doesn't feel like we're there. We might lose time and space. We might last conceive of when we had consciousness as being hours ago. Or it might feel like actually we're looking at ourselves in third person. There are lots of experiences categorised as dissociation where one feels removed from themselves or indeed their consciousness and conception of time and space. I really hope this video has been helpful and clarifying in what is post-traumatic stress disorder, and I really want you to go on now to hear me talk about the psychological theories that can help us understand what maintains trauma and indeed what causes it. So please like and subscribe to Beacon Psychology Service to find out about that information.